Osteoporosis is a medical condition characterized by weakened bones that are more susceptible to fractures and breaks. The term osteoporosis comes from the Greek words osteon, bone, and poros, pore or passage, reflecting the porous nature of the bones affected by this disease. Understanding bone health. Bone is a living tissue that is continuously being broken down and rebuilt in a process called bone remodeling. This process involves osteoclasts, cells that break down old bone tissue; osteoblasts, cells that build new bone tissue. In healthy bone remodeling, there is a balance between the activity of osteoclasts and osteoblasts. In osteoporosis, this balance is disrupted, leading to more bone resorption than bone formation. Causes and risk factors. Several factors contribute to the development of osteoporosis, including age. Bone mass naturally decreases with age. Peak bone mass is typically achieved by age 30, and from then on, bone resorption can outpace bone formation. Hormonal changes. Estrogen, which protects bones, decreases significantly during menopause in women. Men may also experience a gradual decline in testosterone, which can affect bone density. Genetics. A family history of osteoporosis or fractures can increase your risk. Genetic factors can influence bone density and quality. Diet and nutrition. Low calcium and vitamin D intake can contribute to bone loss. Calcium is crucial for bone strength, while vitamin D helps in calcium absorption. Physical activity. Lack of weight-bearing exercise can lead to weaker bones. Regular physical activity, especially weight-bearing and resistance exercises, helps maintain bone density. Medical conditions. Certain conditions like rheumatoid arthritis, chronic kidney disease, or hormonal disorders can contribute to bone loss. Medications. Long-term use of certain medications, such as corticosteroids, can affect bone density. Lifestyle factors. Smoking and excessive alcohol consumption are known to weaken bones and increase fracture risk. Symptoms. Osteoporosis is often called a silent disease because it progresses without symptoms until a fracture occurs. Common sites for fractures include spine, vertebrae, hip, wrist. When vertebrae collapse, it can lead to back pain, loss of height, and a stooped posture. Diagnosis. Diagnosis typically involves bone density test, DEXA scan, measures bone mineral density, BMD, to assess bone strength and fracture risk. Blood and urine tests help rule out other causes of bone loss and assess overall health. Treatment and management. While osteoporosis cannot be cured, it can be managed and treated to prevent further bone loss and fractures. Treatments include medications. Bisphosphonates, such as alendronate and risdronate, help prevent bone loss. Hormone replacement therapy, HRT, can be used to replace estrogen or testosterone. Selective estrogen receptor modulators, SERMs, such as raloxifene, mimic estrogen's effects on bones. Denosumab, a monoclonal antibody that reduces bone resorption. Anabolic agents, such as teriparatide, stimulate bone formation. Lifestyle changes. Diet. Ensure adequate intake of calcium and vitamin D. Exercise. Engage in weight-bearing and strength training exercises. Fall prevention. Modify home environments to reduce the risk of falls. Bone density monitoring. Regular follow-up to monitor bone health and treatment efficacy. Prevention. Preventing osteoporosis involves maintaining a healthy lifestyle including balanced diet, rich in calcium and vitamin D, regular exercise, especially weight-bearing and resistance exercises, avoiding smoking and excessive alcohol. Both can negatively impact bone health. Bone health awareness. Regular screenings if you are at high risk. In summary, osteoporosis is a serious but manageable condition. With appropriate treatment and lifestyle adjustments, individuals can reduce their risk of fractures and maintain a good quality of life.